Hi there. I'm in need, obviously. You probably take me for granted, just like Graham here. But I'm the reason he can run so easily and painlessly. You see, inside of me is really durable tissue called articular cartilage. It covers the end of my thigh bone, so... Whoa! Ow! Pain! Agony! Ouchie! Ouch! Ouch! What have you done to me, you clumsy, clumsy man? Oh, I really hurt. Let's look inside and see what happened. Oh no. Look there, at the end of the thigh bone. My articular cartilage is badly damaged. That rough area is where my cartilage used to be. Graham and I are gonna have to see an orthopedic surgeon right away. One who specializes in treating patients with cartilage injuries. So the surgeon is examining me. He says this kind of injury isn't uncommon. They can happen in a variety of ways. After a fall or other injury, or just from wear and tear. I was really concerned because my previous surgery to fix this problem was not effective. But no worries. He tells me I'm a great candidate for a product called Carticel, autologous cultured chondrocytes. Carticel is FDA approved and uses my own cells to restore my own cartilage. He gave Graham a brochure that says most patients treated with Carticel experience significant improvements in their initial physical limitations, and that those results, which include pain and function, remain durable for up to 4 years. In the clinical study, the most common serious side effects included joint scar tissue formation, graft overgrowth, cartilage softening, cartilage injury, graft complication, graft detachment. Carticel's been in use for over 19 years, and that's why most insurance carriers will cover the treatment. But first, my surgeon needs to look inside of me with a tiny camera and confirm that Carticel may be right for me. Then he'll take a small biopsy of some of my articular cartilage. That small biopsy contains cells called chondrocytes. They keep my cartilage strong and healthy. And once they're multiplied in this FDA-licensed cell processing facility, they'll be reimplanted to help repair the cartilage injury that is causing me pain. My chondrocytes are being carefully grown into millions more cells, and then they'll be placed back inside of me where the cartilage damage is. I control exactly when Carticel is implanted, and my surgeon and I decided that today would be perfect. The surgeon will remove all of the damaged tissue in the area of the injury and inject approximately 12 million of my chondrocytes. Then they'll start doing their thing, creating new cartilage to fill in the area that was injured. Well, time to get my cartilage injury repaired. 99, 98.
Pre-existing conditions, including meniscus tears, joint instability, or alignment problems, should be assessed and treated before or at the same time as treatment with Carticel.
Our surgeon gave us a rehabilitation program designed just for us. He recommended that we limit our weight bearing for the first 6 to 8 weeks following implantation. We will frequently check back with our surgeon so that based on how we are progressing with our rehab, he can recommend the right time for us to get back out there doing the things that we love.
Results may vary and not everyone will achieve full function. In a clinical trial, the average patient was able to return to sports with some limitations, but can participate and/or compensate.
Well, I feel great again, thanks to my surgeon and Carticel.
Indication: Carticel, autologous cultured chondrocytes, is an approved product made from your own cells. It may relieve symptoms related to some cartilage defects in the knee, caused by an injury or repeated injuries in patients who have had an inadequate response to a prior arthroscopic or other surgical cartilage repair procedure. Carticel should only be used along with cleaning up of the defect, placement of a thin flap of tissue taken from the surface of your bone, and rehabilitation of the knee. However, the effects of Carticel and other components of any other therapy on outcome are unknown. Carticel is not approved for the treatment of cartilage damage associated with osteoarthritis. Carticel is not recommended for patients who have had a meniscus removed, unless a replacement or a repair has been carried out prior to or at the same time as treatment with Carticel. Important safety information. Do not use in patients with a known oversensitivity to antibiotics such as gentamicin or materials of cow or ox origin. After Carticel is implanted in the knee, it is common for patients to need another surgery for a variety of reasons. This surgery is typically performed arthroscopically. Carticel is not routinely tested and may transmit infectious diseases to the healthcare provider handling Carticel. Pre-existing conditions, including meniscus tears, joint instability, or alignment problems, should be assessed and treated before or at the same time as treatment with Carticel. Carticel should not be used in patients who have previously had cancer in the bones, cartilage, fat, or muscle of the treated limb. Use of Carticel in children, patients over age 65, or in joints other than the knee has not yet been approved for use. The most common serious side effects include joint scar tissue formation, graft overgrowth, cartilage softening, cartilage injury, graft complication, joint cartilage graft detachment.